For urologists, doctors who specialize in all parts potty, some of the problems they see aren't so funny. Kidney stones, for instance, not funny. You know this if you've ever had one. They're crystals, really, that form in the kidneys. And the kidneys are the two bean-shaped organs near the small of your back whose job is to filter excess minerals and waste out of the bloodstream and send them on their way in the urine. But sometimes these minerals can precipitate out, and instead of passing along, they get stuck.
The kidney stones are not normal. We're not supposed to have them. And if you sort of envision what's going on to your kidneys, the chemistry experiments that we would do where you take a glass of water and you pour salt into the beaker and it would dissolve, and then at some point you'd start to see the salt appearing on the bottom of the beaker. That's essentially what's going on within your kidneys. In terms of our diet and things that are metabolized in our body and wind up in the urine, these substances, when they occur at a great enough level, will crystallize and lead to stones. And generally, they will pass on their own, and some will cause some discomfort. Some kidney stones can cause significant discomfort because they have to pass through the urinary tract.
Yeah, saying kidney stones can cause some discomfort is like saying NASA occasionally tinkers with bottle rockets. They hurt a lot. The pain from a kidney stone has been likened to that of giving birth, which makes sense because the same principle of trying to fit something pretty large through something very small applies here. The ureter, the tube that starts the journey from the kidneys to the outside world, is about as wide as your average drinking straw, whereas a kidney stone can range in size from a grain of sand to a golf ball. Ouch. But if you're lucky enough to find stones still in the kidneys before they've started to pass through the urinary tract, you may be able to avoid the pain of passing the stone.
The fact of the matter is, with advances in technology, patients don't have to pass kidney stones. When we diagnose stones that are up in the kidney, we have relatively non-invasive treatments that can break the stones up into small particles that can be passed without a significant difficulty. Prior to this time, the treatment of kidney stones had consisted of open surgery, which was very invasive and with a much longer period of recuperation.
But you know what's even better than finding the kidney stones before they leave the kidneys? Never developing them at all. And that can happen with a bit of luck and some basic prevention.
Generally, with kidney stones, it's a lot of common sense. We find that it is correlated to the amount of fluid consumption. Clearly, the more water we drink, the less likely we are to form kidney stones. The other thing that it's related to is the amount of protein in our diet. And as our diets have changed over time now, we find that we are consuming much more protein, and it has a very, very strong correlation or relationship of your protein intake and forming stones.
Unfortunately, if you've already got a kidney stone making its way down your urinary tract, there isn't much you can do until it passes. But to help it along, keep drinking lots of water or something with caffeine in it. This has a diuretic property and will actually increase your urinary production and help flood the stone out. I'm Dr. Keller Wortham, and you're watching the eHealth Network.